Hi, everyone. I'm Dr. Ryan. I'm a veterinary behavior residency trained and a veterinarian.
And I'm Dr. Serena. I'm a veterinarian and I am a current veterinary behavior resident. So, Dr. Ryan, I know that you have your Reddit, and we talked about some cat behavior issues, but I know that you also have some dog behavior concerns on there. So, do you have one that you want to share with us today?
Yes, let me share it. It's actually a pretty good one. Let me move to the window myself so I can see it a little bit better. So we have someone named Few Sport 6120. He wrote that like 4 days ago. The topic is separation anxiety. My dog has separation anxiety, and whenever we leave her home alone, she rips the place apart. I have started to feed her 3 times a day to stop her from trying to scavenge for food, and in parentheses, up to the right amount per day, just split her breakfast into breakfast and lunch. This has helped quite a bit too. However, we still cannot leave her home alone. I have tried crate training, but she will hurt herself on the cage, so I'm worried about doing that again. I think we'll dive deep into the different things that this person is writing about. But before we talk about is it actually separation anxiety, and if it is, then what can they do differently and all of that, maybe let's start with the last sentence. So he's saying, or she's saying, I have tried crate training, but she will hurt herself on the cage, so I'm worried about doing that again. And I am curious, what do you think about using crate training for separation anxiety, because it is something very common that many people do recommend doing.
Yeah, so that's a good question. And just like any dog behavior case, I try to approach it with what's going to be feasible for the pet parent, what's going to be feasible for the dog. There are some dogs who have a crate aversion already, and my goal is to not try and make things simpler and easier for the pet parent. And so, if you have a dog that's already crate trained for bedtime sleeping, those ones will be a lot easier to crate train for, departures as well. And then, yeah, we can certainly discuss as to whether or not this is separation anxiety or if this is barrier frustration or other types of frustration behaviors when destruction is occurring. So, from a safety perspective, if it's safer for the dog to be confined, let's say, for instance, it has pica and it's chewing and eating and swallowing plastic, and there's a risk of obstruction while the pet parent is at work, then I think crate training would be ideal, but I would
Mhm.
not do it without the assistance of a veterinary behaviorist or
Yeah.
medications to help reduce that arousal that the dog's feeling.
Mhm.
So that would be kind of my take on it.
Yeah. No, and I completely agree. I think that many times a crate can be a great tool, but it really depends on how we use it and how we get the dog to feel being in it. We can make it kind of like the safe place for the dog, and then we can use it basically whenever we need to use it, and the dog will actually feel a lot better in the room, or sorry, in the safe place, than just roaming around the house. And not just for separation anxiety, right? I mean, you can use it when we have guests over, or if there's like a thunderstorm or something like that, as long as it actually does help the dog feel less fear. Problem is that many times, and I'm guessing that this is what happened here because of the description of a dog that's trying to break out and actually hurting herself, that she didn't have that gradual training, or she didn't have this creation of the cage as a safe place, and maybe she was just, you know, pushed in or something like that, and kind of like, okay, this is your crate, deal with it. And while it's important in many cases, like you mentioned, that because of pica or other things that the dog might hurt herself in the house if she's alone, or might destroy property and stuff like that, and might need to be somewhat separated, then technically, yes, you might need to use a crate. But again, if the dog is actually hurting herself, and we're actually not doing anything, we're actually making things probably even worse.
Yeah.
Now, one of the things that I don't know, I would say were kind of new to me while I was doing my residency was that in situations like that, and because we do use medications for like fast acting ones and daily ones that might take even 4 to 6 weeks to kick in sometimes. But sometimes even the short acting one, the fast acting ones are not enough to calm the dog down so they
Yep.
can be left alone safely in the house without hurting themselves or causing any other damages. And in
Hmm.
those cases, we actually have to tell the owners, look, right now your dog is just not ready.
Yeah.
You might need to have a dog sitter, or you might need to take the dog to a dog daycare if it's possible, or to like friends or family or something like that, so
Hmm.
that someone can supervise the dog until the medications will actually start working, and
Yep.
then everything is a lot easier. But every time you just take the dog and shove him into the crate and leave him there and he stresses out, you're just making it worse, and no medications in the world will help you later, or it reduces the chances that it will help you. So it's a very big risk.
Yeah, and I think what you're describing by shoving the dog into the crate, it's considered flooding. Um,
Hmm.
and the technique of flooding is used in human psychology, but only with consent
Exactly.
from the individual going through the therapy. Whereas the dog, while they can show consent, if you force them to do something without consent, it can both make it worse as far as anxiety and fear, but also can diminish the relationship that you have with your pet. So the human animal bond is the reason that pets stay within the house. If you continue to ruin the human animal bond, then you no longer have that bond. And in some cases, people consider relinquishing their pet because they just can't handle
Right.
the situations that they're in.
Yeah, they say, why should we have a pet if we don't have any bond with the pet? It's
Yep.
kind of like misses the having a pet.
Yep.
So I would say that kind of like the bottom line is that we basically both agree that a crate can be a great training tool, but it needs to be done correctly. And correctly means that the dog actually like using it and can use it as a safe place and not trying to hurt himself when he's there.
Yeah. So the gold standard, at least for separation anxiety, let's just say this actually is separation anxiety. We can
Mhm.
get into talking about that later. But the gold standard is, like you said, you don't leave your dog alone because you're going to make it worse. It's going to
Yeah.
make it harder for you to train later on because those behaviors can escalate. So whether you go to a doggy daycare or you get on rover.com and find someone who can come in,
Hmm.
or maybe during that period, you can ask your workplace if you can work from home. Plenty of people were working from home
Hmm.
during COVID, so maybe there can be some sort of um, bend with your workplace if possible. So
Yeah. How is
certainly
it?
other options.
Rover.com?
Rover, yeah, rover.com.
Yeah.
So
Okay.
a lot of like
They're not
there
sponsoring us, but
They're not
Dog.com.
sponsoring
If you
us.
want to sponsor us,
Obviously, read the
come on.
testimonials. Go with someone that has good testimonials, good reviews. Have them meet your dog first
Mhm.
before you saying like, "Here you go,
Yeah.
babysit my dog." But it's essentially a dog sitting, dog walking service.
Oh, nice. Good. I actually didn't know. And do you know if they also work in the US or is it just Canada?
I think so, but
Yeah.
I've
Like, you know
never
what?
looked. Now
Let's
you're gonna have to look.
Rover.com. Again, they're not sponsoring us, but I'm not
We're just
against
here to
I'm not
share
against
information.
sponsorship, so you know. Uh, let's see. How can I I'll stop this one and I'll add
Yeah.
this one for a second. Share screen. Here, rover.com. Let's see. They also
Right.
have cat sitting. And let's see, let's say
So, or you can put your
dog
zip code in.
walking or house sitting. Let's do house sitting. Let me do something in New York. Let's say Long Island City. And let's say I need someone for. So, first, it seems like they are in New York.
Yeah.
Let's say for a
That's
week
house sitting, and then there's the dog walking, so you have someone who comes in,
and just walks
and
in.
then drop-in visits are people who can kinda come and just hang out
Mm.
with your dog.
Oh, nice.
And then you can see, like, this one has, 29 reviews, five-star rating. That's
Okay.
probably why they're higher on the list,
Yeah. Oh, so
um,
it shows
'cause
you
if
the.
they have a high rating and lots of good reviews,
Okay.
that they put
Good.
them higher in the list.
Okay. Great. Good. To know. I didn't know this one, so yeah, excellent. Always good to know
Maybe
new
if
things.
you need a, like, a 3rd job, then
Yeah.
you put yourself on
Uh,
work.
with the you know with the YouTube and the kids and life. Yeah, I'm definitely gonna do that too.
Yeah. Yeah, exactly.
Uh, okay, so let's go back. I'll open again the
Right, because this was kind of like we just talked about crate training. Now
yes
let's talk about,
the
um,
second half of the
can you
like the first half
define
the big
separation anxiety for our viewers? Define separation anxiety. What is that?
yeah. So basically, and again, it keeps changing. Do I have the book here? You know what? Let's see one of the
Yeah.
actual definitions from a book.
You know that my books are propping up my computer.
Yeah, no, I have two of them, like really
You
close
have
by.
Dr. Landsberg's for,
Yeah, so this is
new
Dr.
edition.
Landsberg's.
That's the new edition.
Yeah,
Just came out recently, right?
yeah. Like I think a few months ago, something like that. And I also have
Yeah.
this one. I think this one is kind of getting older, but I'm pretty sure that they're gonna have a new edition for this one as well.
Yeah. That's
One by
Dr.
Dr.
Overall.
Overall. And of course, there's also one by Dr. Landsberg. Sorry, by
Yeah.
Dr. Dennenberg.
Dannenberg, yeah.
Um,
Just for our viewers, Dr. Landsberg was Dr. Dannenberg's mentor
yes. And there's
in the
also
hierarchy of
British,
mentorship.
I never remember those initials. BVSA, something like that. That's kind of like
You're talking about the European? Oh, you're talking about
yeah,
the
but I
textbook?
think it's like
I don't have
specifically
that
the
one.
British something college behavior. I always forget the name, but it's also good because
Yeah.
it's also a lot of information. But let's see quickly a definition of separation anxiety from them.
So
It makes much.
anxiety is that thought process of something bad is going to happen. It's a thought process of perceived threat. And anxiety can be normal. You can have a normal adaptive anxiety. That's what keeps us safe. And then there's maladaptive anxiety. And so separation anxiety falls into one of those maladaptive anxieties.
Yes. Um, Now, they actually don't call it separation anxiety anymore. They call it separation related disorders, because it is true that nowadays it might actually not be like calling it separation anxiety might not be the right term for it, because
Yeah.
is it that the dog is anxious because he's apart from us, or is the dog anxious being alone, or uh, or is it something else? So
Yeah.
we're not, or is it actually not anxiety, but it's actually fear, right? Because the dog
Right.
is afraid of something that's going on right now. The dog is alone, so he's actually
Yeah.
fearful or phobic. If it's like exaggerated, then it's a phobic response, but it's not anxiety. So I guess that's why maybe separation related disorders is kind of like the new name. Oh, here they even
Mhm.
say it. So I'll read it quickly. Previously diagnosed as separation anxiety, or separation related anxiety syndrome, separation distress, or separation related distress. And nomenclature is shifting in the literature to recognize a cluster of disorders related to separation and isolation from attached figures, examples, social group members, family members, human or animal. Term separation related problems or separation related disorders. Separation related disorders are distressing behavior problems for the pet parent and the pet that can deteriorate the relationship, negatively impact the bond, and affect the quality of life of the pet and the pet parent. And here's the part that we were looking for. Dogs with separation related disorder exhibit signs of anxiety, fear, frustration, phobia, or panic when they do not have access to attachment figures. Um, yeah, and of course, it usually happens when the attachment figure is away, but it can actually also happen not when they're out of the house, but when they're even in a whole different room and they don't have access to. Uh,
Yeah.
Now, I'll say kind of like the common behaviors that we usually see in dogs that will be diagnosed with this condition. Of course, not all dogs know how to read English, so they might behave differently.
Yeah.
But I would say that's kind of like the general. So usually we'll have dogs that will not eat when they're alone, and might or might not defecate or urinate in the house, although they're basically already house trained. And if the owner is home for, you know, with them, they can go for even 12 hours with no issues. But when the owners are not home, they'll go right away after the owner left or pretty fast. Destructive behavior, excessive drooling can be a thing. Vocalization, which is a huge one, and that's usually what causes people to seek help of a trainer or of a veterinary behaviorist, because they get complaints from neighbors and stuff like that. Destructive behavior can be everything. So we said like biting things or scratching the door frames. And I think these are the main ones. Did I forget anything?
I think there are some that will just be frozen.
Yeah.
So they will not sleep, they will not
Hmm.
rest. They'll just be frozen and then constantly listening. So they
Yeah.
constantly have like an ear. Their eyes won't close. And it's almost like they're tired, but they're forcing themselves to stay awake,
Yeah.
listening for their human. Um, and maybe we also talk about attachment figures as well. You mentioned
Mhm.
attachment figures. So sometimes there's one person in a family that is the dog's attachment figure. So it's not the dog's person that feeds them or walks them. It's the person that the dog wants to spend the most time with, because the relationship that people have with their dogs is likened to a parent and child relationship. It's not like we are the alpha, we are the leader, we are the
Mhm.
boss. We are more a parent figure to them. And that has to do with just domestication and the fact that we bring these puppies in their early stages of life around 6 to 8 weeks or so.
Yeah. Yeah. So going back to this, I'll do a full screen so maybe people can read it a bit easier. Uh,
Yeah.
so they're saying my dog has separation anxiety, and whenever we leave her at home alone, she rips the place apart. So we said that this is actually something that does happen with separation anxiety. I have started to feed her 3 times a day to stop her from trying to scavenge for food. Blah blah blah. This has helped quite a bit too. However, we still cannot leave her home alone. So I'm not sure why they still. First, what does it mean that it actually helped her, and two, what does it mean that they still can't leave her? Like, is she still destructive? Is she still scavenging? What do you think about that? Like specifically about the scavenging, for example.
So dogs are opportunistic. So if you leave food out for them, I shouldn't say leave food out for them. If you mistakenly leave food out, you cannot expect your dog to not scavenge. So that's a human error. You have to put the stuff away. But let's say, for
Right.
instance, we're scavenging and it's not food items. They're going into the garbage. Some of them are really smart and they know
Yeah.
how to open the garbage bins, even though they have latches or
Yeah.
covers,
And they
even though,
don't know it's a garbage. They don't care it's a garbage can. For
yeah,
them, it's a food container.
yeah, exactly. So if you take free roaming dogs and you calculate how much time they spend looking and foraging for food, it's about 60% of their awake time.
Mhm.
So if they're awake 10 hours in a day, that's 6 hours of foraging. And when we feed in a dish and we feed once or twice a day, sometimes people will feed 3 times a day, but let's say the average is twice a day, and
Yeah.
you feed in a bowl and they scarf it all down, and now what are they doing? Because they're
Yeah.
finished that in like 5 minutes,
Right.
and they still have that 6-hour window to be foraging.
Yeah.
The other aspect is destruction. Destruction itself is a normal behavior in the dog repertoire as well. Destruction is part of the predatory sequence for dogs. And so you have the eye, the stalk, the chase, the grab bite, the kill bite, and then dissection and consume. So to destroy things and then eat is just part of a normal dog repertoire. It's still a nuisance to the
Right.
humans, obviously. But what you can do to help decrease them chewing on items that you don't want them to chew is you actually set them up with things that they are allowed to chew. So chewing toys or dissection boxes. There's like little holy balls where you can put felt inside. I don't know if you've seen them, but you can roll up pieces of food and you stick it inside,
Yeah. Yeah. Yeah.
and then they have to rip the felt out to get the snack. And
Yeah.
so it just fulfills a normal behavior of dogs.
Yeah. I mean,
So
using
that's
a lot of
one part.
food puzzles.
So
Mhm.
yeah, one part of it. The other part that they said is, the reason that she's destroying things is because of separation anxiety,
Mm.
and I would say, just like any other veterinary medical profession, we come up with a list of differential diagnoses. What are the other causes for destruction of items? One, I already just said it's normal behavior. It's
Yeah.
just that it's a nuisance to humans, but it could be that they're bored. It could
Exactly. And that's a
be,
big one. That's actually a very big one that
yeah,
people kind of like tend not to even think about.
yeah, and frustration.
Yeah.
So
Frustration.
another
Mhm.
way that they could be destroying things. So it might not be separation anxiety, or it's a combination because anxiety does not necessarily just come as one emotional response. You can have anxiety and frustration and fear all in one scenario of you leaving the house.
Yeah. No, I completely agree. And sometimes, like another maybe differential here might be even kind of like it's not exactly a redirected aggression, but kind of like a redirected behavior. So I actually had more than one case of a dog that heard or saw another dog or a prey animal basically outside. And because, well, actually, it kind of like goes with the frustration that you mentioned, but not like being able to actually hunt the target and they just
Mhm.
go and destroy whatever is close to them.
Yeah, so barrier frustration, and
Yeah.
same with being locked in a crate is that it might not be anxiety, it might be barrier frustration.
Yeah.
The expectation is that they wanna be out and they're
They're
confined,
stuck. Mhm.
and then they're frustrated because they can't get
Yeah.
to the area that they wanna go to.
Yeah, and going back to what this person asked about or mentioned about the eating. So again, technically, everything is possible. I'm not saying it is separation anxiety or separation related behavior or whatever the new definition is, and I'm not saying
Separation-related disorder.
disorder. Yeah, SRD, or is it something completely different?
Yeah,
But technically most of them will not eat the entire time that the owners are awake,
yeah,
and that's also something that kind of like make it a bit more complicated to treat, because usually when we try to create this counter conditioning to a situation or desensitizing to a situation, we will try to use something that is associated with something pleasant and something that the dog actually likes, like food. And the problem with separation anxiety is that they don't want to eat. They're just so stressed or they're just so busy staring at the door at the window that they
mhm,
won't eat. And even if you leave them something like a food puzzle, like a long lasting treat or something like that, or even their own food, they're not going to actually touch it at all. They might still destroy things. They might, still hurt themselves even, but they're not going to eat that food.
yeah,
So a dog that will actively try to find food and scavenge for food when the owners are not there, and we don't even know if it will happen when the owners are actually there as well. But
right,
let's say that it doesn't. It does happen mostly when the owners are not there. I would say that I think it's less likely separation anxiety and more likely something else, like
mhm.
boredom.
Yeah, so separation anxiety, we can even separate from abandonment anxiety, being isolated, because with separation anxiety, you see a lot of um, restlessness prior to departures. So when you pick up your keys, when you put on your jacket, when you put on your shoes, they're already like frantic, pacing, panting. Maybe they're vocalizing. So that's a marker of separation related um, problem, disorder, however you want to say it. And
So
then there's abandonment. Once the home human is gone, now they're gone, and there's never been a time where that human hasn't come back, but they don't know. And that's what anxiety is. They're sitting there thinking, is my human going to come back?
mhm,
So there's actually like two sides to that.
yeah,
And so when you start working on your desensitization and counter conditioning, it's not at the door, it's at the moment where your dog notices that you're leaving. So
yeah.
if it's picking up the keys or if it's dressing a certain way where you're like, I'm going to the grocery store and I put on regular clothes instead of staying at home in my pajamas, then that's a trigger. And so when you start doing your desensitization and counter conditioning, you're way back on like getting changed.
So I think because it's such a common topic and such an interesting topic, we should actually do the entire next episode on diagnosis and treatment for separation
Right.
related disorders.
Yeah.
But for today, let's stop here. So
Mhm.
everyone, stay tuned for next week because we are gonna talk more in details into how we actually diagnose and treat it. In the
Yep.
meanwhile, if you have any questions, feel free to comment that below.
Yep.
And
See you soon.
yeah, see you then. Bye bye.
Bye.